Ramsey. I'm the co-chair of the Windsor Health Coalition. I'm joined here today at this press conference by Lisa Gretzky, who's the MPP for Windsor West, Taras Natashak, the MPP for Essex, Tullio DePonte, who's president for Unifor Local 2458, and Natalie Mehra, who's the director of the Ontario Health Coalition. So we're here today to call for emergency measures to be implemented locally and provincially to help with the serious outbreak at the Village of St. Clair Schlegel Home, long-term care home in Windsor. Locally, our numbers have exploded and many homes are in a crisis on the edge of a staffing collapse. We look locally at the reporting from the Windsor Essex County Health Unit this morning. We see Chartwell St. Clair Beach with 31 cases in outbreak, Berkshire Care Center with 35 cases in outbreak, and the Village of St. Clair this morning is reporting 79 in outbreak with 48 residents and 31 staff. This number has jumped overnight, and in all homes that have followed this pattern of rapid spread in Ontario, the longer the action takes, the greater the infection rates and the loss of life. We can't sit by and expect this very serious crisis to resolve itself on its own. So today you're going to hear from all of us, but we're calling on the medical officer of health, Dr. Wajid Ahmed, to immediately send inspectors. We have family that have called a hotline, which Natalie will discuss, and they're being told that there's a 4-day turnaround on even a return on the phone call. This is unacceptable. So we're calling on the medical officer of health to issue an immediate compliance order, as they have done in York, Toronto, and Simcoe public health units around serious outbreaks to protect the staff and residents and ultimately to save lives in Windsor, Essex. In all cases, the movement of local public health unit orders have pushed the province to respond with management orders. And the public health unit can implement a management order without the province as well. And we firmly believe that this isn't the time to play a jurisdictional hot potato. The Ontario government has done nothing substantial for Windsor Essex, and we need to push them. But we also understand that we can't afford to wait for them to respond and act. So we do need urgent action from the health unit to help save lives. And we know that they're resource strapped. We know that they're doing everything they can. Our community stands with them in asking for more adequate funding for our local public health unit right now, because they are also in a crisis of their own. We know that we need the contact tracing to continue. And I just mentioned that because this is the only tool we have to prevent unchecked spread in our communities, like we're seeing happen in Toronto. So we're asking for the public health unit to act today to issue orders to protect the staff and residents in long-term care at the Village of St. Clair, but to also look at using these orders where necessary across our community. So now I'll turn it over to Tullio DePonte for remarks. Tullio.
Thanks, Tracy. Thank you, Tracy. I appreciate the introduction, and thanks for everybody for being on. Obviously, I'm the president of Unifor Local 2458, and I have the privilege of representing these COVID heroes, and they are real heroes. Unfortunate part this week, we've had a major issue going on at that Village of St. Clair. Not only the sadness part about all our the residents being infected, but our members being infected. And we had to fight over PPEs, especially the N95 masks, which should never have taken this long to get our members to get them. Secondly, we shouldn't even have the debate about whether they need them or not. It's a pandemic we're in. And the idea that we have to debate the fact whether someone needs a PPE if they're dealing with COVID patients or not is unconscionable. And we can't have that. So our members are scared, but they want to go do the job. And the only way they can do the job if they get the proper equipment. And that proper equipment at this point in time dealing with COVID patient is an N95 mask. We're short. We've been short for years and years. And through this pandemic, and I'm sure somebody else is going to talk about how short the staffing is, it's gotten that much worse. And if you don't give the staff the proper equipment to do it, I don't blame them for saying, I can't go in there. I can't risk my life and my family's life to go in there and try to save somebody. So I shame on this company for making us get into a debate whether they need it or not. But I could tell you as of right now, and I only got a couple of minutes, so I want to make sure I get it all in. As of right now, with the pressure of the union and the public and the people that you see on this panel, the company has changed their mind. they are going to give anybody that works with COVID patients the N95 mask. And I could tell you at one point, there was also a waiver that was attached to it. They got rid of that waiver. So I want to thank everybody for making sure that we were all on the same side, that these workers deserve the N95 mask, not only because it's a directive, and this company was basically violating the directive from the provincial government, but to save their lives so they could save the residents' lives. So I think fighting back, we did what we had to do. We wanted to protect our members, but most of all, we wanted to protect the residents in that facility. So thank you very much. And if anybody has any questions, obviously, once we're done, I'll be happy to answer it. And I just want to say something about that picture, the background on my thing. That was a rally we had in order to make sure owners, private homeowners, for profit, that they treat these COVID heroes like they say they are. But we had to do a rally to make sure they understood that, and they keep on treating them like COVID heroes. Anyways, I'm out. I don't know. Thank you.
Thanks, Tulio. And thank you, Tracy and Lisa and Therese. So we started hearing from a family in the home who are in the village of St. Clair, the village at St. Clair on the weekend. That the unit that their family member was on was extremely short-staffed, that at least half of the staff on the unit had not come into work. We understand there may have been testing happening at the home at the time, but nonetheless, half of the staff complement and residents were having very serious problems actually getting basic care, food, was delayed, actually having their bells answered. And then that continued through Sunday, where staff, in order to get the staffing level to a level where even basic care could be provided, staff worked back-to-back shifts. So one staff person was in from 6 a.m. till 6:30 a.m. till 10 p.m. on Saturday, came back in on Sunday. Another staff person worked from 10 till 10, came back in on Sunday. So double shifts, back-to-back shifts. And then on Tuesday, the same thing, half of the staff not there in the afternoon on the unit. Very, very severe problems in staffing. And of course, in a home where now at least 31 staff have tested positive, there was inadequate staffing to start. When you imagine then that you have 31 staff on isolation at home and not available to work, the staffing very quickly starts to crumble in these homes. And we've seen this now as home after home after home has fallen into these massive, chaotic and disastrous large outbreaks across the province. The response from the provincial government has been unbelievably inadequate. It's shocking how little is actually being done to ensure that the very elemental pieces of care, feeding, bathing and hygiene, basic hydration, any human company at all is being met. And we're very frightened about what is happening, particularly at the village of St. Clair, but as COVID-19 is spreading across Windsor's long-term care homes, there are measures that can be taken. And so I just want to outline this. We've been watching, as closely or possibly more closely than anybody, what actual measures are being taken in the homes to get emergency teams in, to get management orders where management is incompetent or grossly negligent, where they're not providing PPE as they should, where they're not acting to address critical shortfalls of staffing or where staffing has crumbled completely. And those measures include, in some areas, local chief medical officers of health have made orders, in York Region, for example, on the homes to require them to provide PPE and infection control and to require them to provide sufficient staffing. Those orders can be backed with fines up to $5,000 a day. In some areas, chief medical officers of health have made orders for management takeovers of homes and have arranged for hospitals to come in and do that. In some areas, but only a handful, the Ministry of Health has issued management orders. At this point, there are, I think, eight of them across Ontario, and that's it. But issued management orders to have teams come in to take over the management and provide support. There are also SWAT teams, as they call them, or rapid response units from hospitals in areas that can come in. Of course, the hospitals are also facing capacity issues, and the total failure of the provincial government to plan over the summer and build capacity for this has come back to haunt us in the most devastating way. But nonetheless, it has to be done. There are measures including the Red Cross. However, the Red Cross is quite limited in what it does in the homes. It can provide some support, but it does not replace the staffing for the, PSW and nurse staffing in the homes. And so those are the measures that can be taken. So from the ministry, they can do management orders or management agreements. From the local chief medical officer of health, they can do the same thing. The ministry also has the power that they've been sitting on to levy fines if they want to, suspend licenses or revoke licenses. There are teams that can be called upon to go into the homes to support the staffing and make sure that people don't starve or die of neglect and dehydration, which is happening again. And so we're extremely concerned, and we're calling for those measures. In the most extreme, of course, the military has been called in the last wave. We are, I think, getting possibly to the point that might have to happen in this wave. And if there is no capacity in the local hospitals to provide support, then measures like that need to be looked at. I just want to end by saying this. If a plane were to crash in Windsor, no matter what the situation is in the health system, everyone would provide care for those trauma victims. It would happen. These people are elderly, yes, but their lives matter, and they deserve the same resources and the same attention when they're at risk as they are right now. Thank you. Should I just pass the baton here? Tracy, you're on mute.
Oh, sorry. We'll go to Lisa next.
Thank you. I think that the three before me covered a lot of ground, so I'm just going to add a little bit to that, to what Tulio said about the frontline workers, and to staff, and Natalie about there not being sufficient staff. This is not a new problem. It has only been made worse by the pandemic. The government is currently sitting on $12 billion in COVID funding that they have yet to allocate or spend in order to alleviate some of the issues that we're seeing locally as far as our public health capacity, our hospital capacity, and what is going on in long-term care homes. And they need, what the province needs to be doing is stepping up and using every tool that they have at their disposal, everything that they have in order to address the issues that we're seeing. So while we're having capacity issues locally with our hospitals and with public health, and we know that all of those workers are stretched really thin, the government has the ability and the funding to come in and provide resources. They just need to do that. And it's not that they're unaware of what is going on here. They are well aware of what is going on here. They're well aware of what's going on at the village at St. Clair. So their current inaction is frankly negligence on the part of the government. But I also want to point out that this particular home is owned by Schlegel Villages, which is a large for-profit company. They put money out to their shareholders, but they're not investing in the frontline workers, and they're not investing in ensuring that these residents within this home are getting the hands-on care that they need. The government recently announced that their goal is to have 4 hours of care. I believe it was in 2025. That is not good enough, and there was no money in the budget to follow up on that promise. They have $12 billion that they have no excuse to be sitting on in order to address the issues that we're seeing, to be able to come in and take over management of this company, but more importantly, to hold this company accountable. Again, they are private, for profit. They're making lots of money. There is absolutely no excuse that they are withholding PPE from staff or telling them that they have to sign liability waivers in order to get the PPE that is very clearly is legislated they should have. If the PPE is not fitted appropriately for the staff, not only does it put the staff at greater risk of contracting or spreading COVID, but it puts the residents that are in their care at great risk. So that we need this company to be held accountable. And I would be remiss if I didn't point out that the owner of Schlegel Villages, Jamie Schlegel, is on Doug Ford's provincial long-term care table. He is someone who is advising this government on how to move forward in long-term care and trying to keep COVID out of these homes. And yet his home here in Windsor is one of the hardest hit homes, if not the hardest hit home in all of the province. So he needs to be, since he's got the ear of the Premier needs to use that connection with him to hold him accountable, ensure that he's making the investments that he needs as far as staffing and PPE, and ensuring that these residents are getting the care that they need in order to keep themselves safe and healthy. And the last point that I wanted to make is that while there are some residents who are having access to their essential caregivers, or as the government wants to call them, essential visitors, that is not the case for many of the residents in this home. The home has made a decision to lock, to stop residents from being able to access their family caregivers. The province has the ability, not only do they have legislation that I put forward that they could pass in order to come up with a strategy to make sure that this is happening consistently and meaningfully, and that there's enough staffing and PPE in place, but they have the tools that they need now to override that decision, to make sure that that PPE is in there, the staffing is in there, and that everybody has what they need. By locking these essential visitors, these family caregivers out, they are essentially, the company is taking away an extra set of eyes and ears to report back to the public and to the health unit on what is going on inside these homes. But they are putting even greater strain on what staff are still in the home, because these essential caregivers often went in and performed, they made sure they were there to have a meal with their loved one and provide that emotional support that they needed. So it's really important that the government ensure that all the tools are in place to make sure that those essential visitors are allowed into the home, and that home is fully staffed up and they have the appropriate well-fitting PPE that they need.
All right, just before we move on, I just want to note that MPP Wayne Gates has joined the call as well. I see that he's on the line there listening in. So we'll move over to Taras Natashak, MPP for Essex.
Thanks so much, Tracy. I'm honored to join all of you today, and I want to thank all of you, but especially Tulio, yourself, your leadership, your members, the healthcare heroes that you represent, and the work that they are doing in homes in and around Windsor and Essex County and all across Ontario every day. You are indeed healthcare heroes, but also angels among us. Speaking of angels, Natalie, Mehra, who heads up the Ontario Health Coalition, who acts as a watchdog over all aspects of healthcare delivery, primary, acute, long-term care. If it were not for the efforts and the ability to provide that oversight, we may not ever know what the issues are in our community. So you play a vital role in supporting residents and supporting families and caregivers, and that's why we're here today. I'm here and proud to echo the clarion call that this is a crisis and our region is on the verge of collapse when it comes to supporting our elders. And that's what I want folks to remember, that these people are the builders of our communities. They are our mothers, our fathers, our grandfathers, grandmothers, great grandparents. They have worked in every aspect of our community. They have built our communities, and it is our responsibility as leaders, as legislators, to provide them with the care, dignity, and respect that we promised them. This is a social contract that we made to each other, that we will ensure that the regulations protect you in your later years. And right now, what we're seeing is a total abdication of the Ontario government to provide that support and that safety and the safeguards in place. So it could not be any clearer for the Ministry of Health, the Ministry of Long-Term Care, and the Premier Doug Ford to acknowledge what's happening here. They've known for quite some time. And as New Democrats, as members of the official opposition, we have warned them time and time again that they needed to act before the second wave, when we knew that a massive hiring and training and deployment of personal support workers needed to happen, similar to what happened in Quebec, where in the midst of the height of their first wave, they knew they needed to prepare for the second wave. Our Premier did not do that. Our government did not do that. In fact, up until 2 weeks ago, the last sitting of the legislature before they recessed, the Minister of Health denied that we were in a crisis. Absolutely denied it. It's on the books. You can check it out. That is that's a level of obliviousness that I think is reprehensible. So the actions that we're calling on the part of the government are quite clear. You have $12 billion of public taxpayer dollars that are needed desperately right now to support communities all across this province, no more acutely than right here in Windsor, Essex County. Ensure that we have proper personal protective equipment for those healthcare heroes that are on the front line doing that work so they can protect themselves, protect the residents, and protect the broader community. We cannot have this fight. We know how to win this battle. We know how to get a handle on COVID in our communities, in our long-term care centers. This is something that I can't imagine the government isn't aware of, but we will continue to sound the alarm and to press this government into action with all of the force in our hearts, and with support from those in our communities that are on the front line.
Okay, thank you, Taras. We'll take questions from the media. If you can just, if you can post into the chat that you have a question. If not, if you can just identify yourself when you go off of mute, that would work well. And we're open to questions.
See, I just wanted to mention, I see that Anne Dubé is here as well. I think she's on the phone. If there are any questions for her, her mom is in, the village at St. Clair. I think Anne is inside the home right now.
If I can just take a minute while we're trying to get Anne on. I'm sorry, I forgot to mention that Percy Hatfield is aware of what's going on and he's involved. Unfortunately, he was not able to join us today on the press conference.
Thanks. I was just mentioning Anne in case media had questions directly for her, but if media have questions, we're good to go.
Okay, we've got a question from Mark Brown. For Tullio, we've been told that Jerry Dias is very aware of the situation and has called for the home to have its license suspended. Have you spoken with Dias, and can you communicate further or comment further? Tullio?
Yeah, obviously we're in contact with our national union, especially Jerry Dias is in tune on what's going on in Windsor and right across this province. And he did call out for this home for the government to suspend their license and take over this home because of what's happening. Obviously, we're very concerned about our staff, but we're concerned about the residents that live in these facilities. And Jerry wants to make sure that everybody stays safe. We have the tools. We have directives from this government that clearly says, in order to protect the workers, they have certain PPEs that they should have. But because of the fight and because of the stubbornness of this employer, I call it stubbornness, because it's clear that the tools are there, the N95s, they told me in no uncertain terms, they had the N95s there. And for them to try to shed their responsibility and have our members sign a waiver before they would get a N95 mask, it's unacceptable. Not only from myself as a president of this local, from our national union, it should be unacceptable to anybody that's listening today. So Jerry Dias is well in tune on this. I think he's doing a story with the Windsor Star next, but he's totally behind us, and we have the full support of our national union.
If I can just add too, we all of us on this call have a copy of the waiver. Should any of the media want to see a copy of the waiver that staff were asked to sign before they could get their N95 masks.
I also wanted to say we have copies of the orders that have been issued locally from public health units. We have a copy of the order from York Region. There are orders to Simcoe. Natalie referenced these orders in her remarks as well. The fact that locally out of our public health unit, we have the ability to issue an order pursuant to section 29.2 of the Health Protection and Promotion Act is a tool that can be implemented from our public health unit here immediately. And in many cases, the action of the local health unit is what has prompted the province to act. And I believe that Natalie, if it wasn't in this call, another you referenced that many times the province has actually said to the local health units, we need you to implement this so that we can move and act. So it's very important that we start at the local level while we're waiting for the province to move.
I didn't want to jump in and add on, but I just want to clarify. So both the province and the local public health unit have powers to intervene here. And we don't want to get caught in a shell game, but that looks like what may emerge, in which the local public health unit says, oh, the ministry has to come in. And the minister said, 3 weeks ago or so, that the local public health units should be making the orders. They have powers under their act to intervene. The local public health, the chief medical officer of health has powers to intervene. You know, it's people's lives that are on the line here. So no shell game, no nonsense. We need an intervention. There need to be staff that get into this. They need to get in right away. 31 are already infected. That means many more in coming days. And that means that the staffing will crumble unless there's help. That's what's happened in, you know, home after home after home. So I don't want to repeat myself. I just want to say, like, let's not accept a shell game from anybody. Nobody can shift around blame here. As I say, if a plane was to crash, it would be all hands on deck and people would receive the care they need. And, you know, the fact that these are elderly people in long-term care should not change that.
So can I say something else there?
Yeah.
You know, from dealing with staff and actually calling me, it's heartbreaking. They have to cry on the phone to say, can you please help us? We want to make sure that we're safe so we can take care of these lives. I can't believe that we're actually talking, and we're talking about the fact is that the government is not doing this, the health unit is not doing this. We should all be in this together. We all call our staff heroes. We all call them, we honk our horns, we have parades, we have that, but when we need them the most, government is not there for them. And the health unit needs to step in. I had a sleepless night last night because I know there was people going into that home that were going to work short, and maybe they weren't going to get the proper N95. Yet they were going in there to take care of those residents, like Taras said, our loved ones, our mother, our father, our grandparents. And shame on the people that can make the changes for not stepping in right now. It's been 4 days since we found out. This has started on Saturday. And we waited till we have 48 residents, which I believe there's probably more than 48, and 31 staff. 6 more than yesterday, staff members. That's a shame. And I can't believe that we're actually have to do a news conference. The government should take it upon themselves to do whatever they need to do to take care of the residents, and especially take care of the ones that are taking care of the residents. Like Taras says, they deserve a lot better, a lot more. So it's frustrating to me, and I'll do whatever I need to do to make sure that our members are safe. But we need everybody, the media's help. Put pressure on this government, say do the right thing, step in and make sure you're doing the right thing. As you can see, I just can't believe it. And all these years, I've been doing this job for 40 years. I never thought I'd live through a pandemic. And I was hoping, because if we ever did live through a pandemic, that everybody would be on the same page. I guess we didn't learn nothing in March. So the old saying, if you don't learn from your past, you'll repeat it. So that's what we're doing. It's unfortunate. Thank you.